My name is Dr. Jeff Bill, and I'm the founder and CEO of Sunrise Treatment Center. After I finished my family medicine residency in the summer of 2006, I returned to my hometown on the west side of Cincinnati to begin private practice. At that practice, there was another physician who was already certified to prescribe Suboxone to treat people for problems with pain pill and heroin. Since she was leaving the practice, she asked if I would go ahead and do the training so I could continue their care. For the next year, I tried to provide those services out of that family practice. But all along, I thought that if I could find a space to really focus just on the addiction care alone, that it would work out much better for the patients that I was trying to serve. And with that, a year later in October of 2007, Sunrise was born. In the years after I founded Sunrise, I sought out more and more experiences working with other organizations to provide medication-assisted treatment. What I noticed was that the offices were mainly focused on the clinical services and didn't have as much involvement from the medical side. From my perspective, since we were using a medication to help people with their substance use disorder, I thought that it should be an office that looks and feels and runs like any other office where any other chronic disease process is being managed.
The patients from the medical appointments can expect, of course, per our core values, to be always treated by the medical providers with dignity and respect. We will always follow up on any conditions that we have identified on prior visits, such as hepatitis C. If we identified a patient with hep C, that, hey, have you followed up? Have you gotten treated? Where are you on that? Have you established care with a primary care provider? We will always encourage that, and to keep up with their health maintenance if they're due for colonoscopies, mammograms, pelvic examinations. Those are the things we stress in our medical appointments. Also, we will review their urine drug screens, see how they're doing on the road to recovery as well. So we encompass the recovery aspect of it and the medical aspect of our patients.
I think it's really important that a patient gets a full medical evaluation when they first walk in the door. We all know that everyone is presenting with a substance use disorder of sort, but really we need to know who they are as a person, where they're coming from, what other medications they take, the social history, where they're living, who they live with, things about their family. It's just very good to know any kind of medical conditions they might have, which could affect their care. In particular, hepatitis C, that's something we see very often. That's something we treat at Sunrise. A lot of times patients will come here and they've been told over the years that they have hepatitis C, but no one's ever offered to treat it. Or they will have been referred to a GI doctor or infectious disease doctor, and it takes so long to get in, they oftentimes don't even go. So that's one important medical condition that we screen for with every patient that walks in the door. That's another reason why it's very important to get a full medical evaluation.
So our patients will meet with a medical provider, whether it's the doctor or the nurse practitioner, on intake. We'll meet with them again about 4 to 6 weeks after intake, and then we'll meet with them every 3 months for the duration of treatment at minimum. We can always meet with them in between those visits if anything comes up. They will also meet with the medroom nurses at each visit to pick up their medication.
The counseling part of recovery is critical to the change process because you're looking at longer term processes with behavior change. So if somebody comes into treatment and they are immediately addressing the medical component of physical withdrawal symptoms or needing to be on medication assisted treatment, then you can think of that as a short-term objective, and then the counseling is more of the long-term objective. So it takes a while to establish the therapeutic relationship in order to build trust with your counselor, and it doesn't occur overnight. It takes a while to really work through some of those behavior changes that need to occur. When somebody comes into treatment, it's often a time of tribulation in their lives, and we want to make sure that people feel comfortable when they walk in the door. We want to make sure that they feel that they are not being judged or taken advantage of. So as they enter the treatment process, it's important for them to understand that they are the reason that they're here, and that they can be an agent of change in their lives in a positive way.
The core values at Sunrise were rewritten in 2018 by a group of employees. We identified 12 individuals across our organization to work with our corporate and executive staff at determining what's important, what they see going on a daily basis, and what embodies us as an organization. So they came up with some amazing values that are really meaningful. Probably the most prominent one is treating others with dignity and respect. That goes to both staff as well as patients, and we adhere to that on a daily basis. Other excellent values that they came up with have to do with innovation and creativity and forgiving mistakes. We talk a lot about loving and compassion and using those in our everyday decision making. There's no job that's too big or too small. We want to be the best at what we do and adhere to the highest ethical standards. So some of those are the core values that are critical to our day-to-day functioning.
When patients arrive at our locations, they can expect a very clean and professional environment. Coming into the doors, into the waiting room, the furniture is well kept, it is organized, it's not in disarray. We have color palettes that match all of our locations. The artwork we put on the walls is very nice. Many of our locations have inspirational artwork, and other ones just have very nice scenes in them. We're proud of the work that we do, so we have our certificates all framed and our licenses and certifications clearly displayed for our patients. So from just start to finish, it's a very professional, clean, well-run experience for the patient. Our Middletown office is located on Briel Boulevard near Miami University and Middletown High School. This site services residents of Middletown, Trenton, Franklin, Monroe, and the surrounding areas. Our Dayton office is located on Cincinnati Street in the Montgomery County Business Solutions Center near Love's Truck Stop. This site services residents of Dayton, Moraine, Kettering, Inglewood, Beaver Creek, and the surrounding areas. Our Piqua office is located on Garbury Road at the Garbury Road, Mooney Road roundabout. This site services residents of Piqua, Troy, Covington, and the surrounding areas. Our Springfield office is located on Parker Court behind Goo Goo Car Wash and O'Reilly Auto Parts. This site services residents of Springfield, Enid, Yellow Springs, and the surrounding areas.